right, going on to the second demonstration, we are going to do the flushing of the central venous catheter. And again, we are going to be working with the PICC line. It's the most common one that nurses work with, but again, you could be having a PICC line, a central line, or a portacath that you could be working with. So we're going to start with the PICC line. And the PICC line, again, we would check the policy and the procedure for flushing. Everybody's is a little bit different. So I'm going to follow what we recommend at Trinity. I would gather my supplies, and what I need to have going into the patient's room is that I need a flush. And again, this is a central line, and we need to make sure that it's maintained open because it's can be in for a longer time than a peripheral catheter or IV. So we need to do heparin, and make sure that you grab the heparin flush. There's a difference, so be cautious and err on making sure you grab the right one. So I grab my heparin, and my heparin again, it is on the box. There's 100 units per ml, and there is 10 mLs in here. So there is well over 100,000 in here. Okay, so at the hospitals you would not get a big vial like this. You'll get a small little one. Okay, so we would grab a 3 ml syringe. We need to grab a minimum of a 10 ml syringe. Central lines, if you work with a syringe less than 10, this pressure in this little catheter can collapse that catheter in the vein. So you're not allowed to work with a small syringe. It has to be a 10 ml syringe. So we grab that too. Okay, so we gather our supplies, and we'll go into the patient's room and introduce myself. I'm Dawn Rumpho, I'm your nurse, and today is the time we need to flush your PICC line. So I would grab my gloves, making sure I washed my hands. Okay, so I need my alcohol, and I need to flush the lines. So there is 2 here. The 2 go into 1, so you can choose which one you want to use. You don't need to do both. But again, that could be different at different facilities. So I'm going to take the red one, and I'm going to cleanse it just like I did with my Pep-Lock on my IV, twisting back and forth, cleaning for 15 to 30 seconds, letting that air dry, making sure nothing touches it or contaminates it after I've cleaned it. While that's drying, I'm going to go ahead and I'm going to draw up my heparin. And again, the order for heparin, to flush with it, you need to have 3 to 5 mLs of 10 units of heparin. So if I draw up a full 1 ml of heparin, it is going to be 100 units, and that's not what the order is. We need to draw up 3 to 5. So we only need to draw up we're going to draw up 3. My bottle's leaking, so I've been practicing. So we have 3. Okay, so the first thing I need to do is after that I'm going to grab my flush. Get my air bubble out. Okay, so then I'm going to connect to my Hep-Lock, and then I need to open up this clamp that is on the line. So I need to open that up, and I need to gently pull back and make sure that I'm getting blood into my normal saline. If there has been IV fluids running in this, sometimes you won't get the blood, but most of the time you should get a blood return back in here. So next thing I need to do is I need to flush. And what we do when we flush a PICC line, we just don't push it in. We do what we call a push and stop, push and stop, push and stop. Reason why we do that is because if there is a possibility of a clot that has been trying to form on the end of the catheter that's in the vein, this won't all of a sudden burst and float off. It could help break that down, that clot down. So that's why we do a pause and a push, pause and a push for 5 mLs. Okay, so we have flushed it. So the next thing I need to do is I will grab my heparin and connect. And again, doing that pause and push, pause and push, pause and push. And at the very end, that very last bit of a flush, you need to, at the same time pushing, you need to clamp your little white clamp. 1, 2, 3, clamp. And what that happens to do is it causes a positive pressure in that catheter, so it helps for keeping it open so it doesn't occlude. In some places now, they have come with a new device where they have a positive end pressure that they use instead of these regular hep locks that we do on the peripheral IVs. Okay, so then after that, we would, again, making sure the patient tolerated it well while we were flushing, we would document the date, the time, how the patient tolerated it, and if there was any difficulties flushing the catheter. Okay, so that's how you do a flush of a PICC line with heparin.